introduce something about facial scanning. And today I'm going to speak a little bit about facially driven treatments, as the title says. I will give some tips on what we have to check when we start introducing ourselves to this kind of treatments. So, first of all, I want to give a special thank to Shining for supporting this kind of events and for developing such interesting devices. In the last few years, Shining has been evolving in the dental area in a very nice way, and I hope that they keep doing this in the future, because the products, in my opinion, are excellent. So, being this said, as Clara said, uh, as you can maybe see, I'm not a native English speaker. I'm from South America. Here we speak Spanish. I'm from a very small country called Uruguay. In 2009, I moved to Chile, where I started studying my postgraduate in buccomaxillofacial implantology. And now I'm a professor at the same university where I studied, in the University of Chile. And in 2011, I started studying and searching about the 3D world. It caught my attention. First, I started studying about how to convert DICOM files into STL files, and I dived into this world because I found that it was great, and the things that we can do are even better. So that's where my journey started, from converting DICOM files to STL files. And the first question that I always make to myself and that I always make to other people is if the pre-op planning is really the clue for success. As you maybe know, this guy that is in the picture, it's Professor Brannemark. He's the father of the modern implantology. And he always stated this. And nowadays, while we make and get things cheaper, we have better access or easier access to things. And why I'm saying this? Because, for example, the failure rates of implants have raised a little bit because implants nowadays are cheaper. More people are putting or placing implants into the maxillaries and jaw. And that's why we may have more problems. It's like when, for example, cars were massively built by Ford. They started crashing more and there were more accidents because there were more cars in the street. And this is analogic to what we do and with technology, because nowadays we have, for example, intraoral scanners, facial scanners, CBCTs, and things that are cheaper, and people are getting this kind of technology. But do we really know how to use them, when to use them? And the question again is the clue of our treatments the pre-op planning? We will see that in the next few slides. And the question is why? For example, why do I need this? I have to ask to myself, why do I need to have a virtual patient inside my computer if we've been doing things in an analogic way for several years? We have had good results, but now it looks like a boom that everyone wants to get this. And we always have to think that the challenge for our restorative dentists is to get patients with nice things. Nowadays, people don't want to look bad. They want to feel and look nice. And there's where we need to start helping them. And here it's where technology is gonna help us a little bit. For example, we've been working with this conventional workflow for several years. We all know how to make a bite block, like the one that you're checking inside that slide. And this is traditional dentistry. But with traditional dentistry, we've been always facing some problems because maybe between our dental practice and the local lab, we will be missing some information. In the late 2010, in the early 2010, Christian Kochman introduced a very nice workflow for the DSD, where we had to take some pictures, place those pictures with a ruler, check different aspects, and send out those aspects to our local lab. And it was a great improvement. But we are still having a problem. Some blocks of our chain might be missing while we transfer our staff from our dental practice for the local lab. And these kind of things may be familiar to you. For example, here we are trying a WhatsApp, and look where the midline of those teeth is. It has nothing to do with the midline of the face. And these are things that might happen because while we are working in our dental practice, maybe we are not standing perfectly where we should be standing, and we might have problems of perspective. And these kind of things are going to be an issue because maybe when we are working with our bite block, we will try to put the midline of those teeth in the bite block in the best position, but maybe I was standing in the right side of the patient, and due to problems of perspective, I'm putting that midline not perfectly centered. And when our dental technician starts making the WhatsApp, he's going to take in care the midline that we have put in the bite block, and that's going to be an issue, and here you have the result. Other problems that we might be facing, for example, here, those heels of those lateral incisors are in a very bad place. Also, that patient has a gummy smile. So we are facing two problems. The patient maybe didn't know how high does that patient had her smile, and he is not sitting and moving with the patient in our dental practice. So here is the result. It's not the most beautiful. I think that people nowadays do not want to get this kind of results. And that's why there has been a growing interest in minimally invasive implant placement, obviously with the option of delivering a prefabricated provisional prosthesis immediately. That's what everyone wants today. They want to plan, get their surgical guides, get their provisionals, and after placing the implants, put those provisionals inside the mouth and deliver the patient with that as soon as possible. But we need to know and predict how this is going to be. It is possible doing it in an analog way, but as I have shown you, there might be some information that it's going to be lost while we take those things from the dental practice to the local lab. And when we start speaking about different kind of things, this is applied technology. This image makes a lot of sense. This is not just for dentistry. This is a generally used image. For example, as Derek says, we have innovators, for example, Shining 3D. They've been improving things. They have been releasing things to the market, and those are the innovators. And after those innovators come the early adopters. For example, I've seen something that Shining has released and I want to get it because I think that it's going to be a nice tool and it's going to help me in my daily practice. But I have to start learning about this, and I will have to start using. I will have failures. I will have to start working over those failures so that those innovators can improve what they have taken to the market. But there's a big problem because between the early adopters and the majority, we have that chasm. And it's very difficult to jump that chasm without falling inside of it. And in the other part of the chasm, we have those early majority that are looking to us, thinking about what we are doing and what we are going to get about that, and they want to adopt that. And maybe many of you who are hearing me now might be thinking, all right, yes, it's nice the facial scanning. I think that it might help me, but is it going to be a good tool, a good partner for my daily practice? That's the early majority. And that's a comfort zone to be, because you will keep on working your daily practice without making mistakes, while I'm making a lot of mistakes trying to improve some protocols. So this is a very nice graph. I think that if you haven't already taken a screenshot, you should search it for it in Google. There's a website where you can take it. So how can I perform a face scan? And here it's where we will start trying to jump that chasm, and I'm going to try to help you not fall into that chasm. So there are different alternatives to digitize. Maybe for some of you it's gonna be familiar what I'm going to say, but for example, you can scan a patient, the face of the patient, if you have some time and you have worked with the software of the intraoral scanner. You can deactivate or disable the artificial intelligence, and if you put some tracking points in the face of the patient, you will be able to make a decent facial scanning. It's going to take you some time. Maybe the patient is going to get bored, and as you know, the main problem of all these protocols now, it's that the patient has to remain static. They have to force their smile. And maybe with this option, it's going to get uh, a little bit tough to do it. Shining, it's not just delivering devices for dentistry. They are a big company that creates devices for the industry. And they have some interesting options that might help us with facial scanning. I believe that they are going to release something in the next few months that it's going to help us in our daily practice, and that it's going to be able to help us match all the information that we need in a perfect way. So facial scanners are out there. You can search in Google. You will see that there are different brands that are offering different kind of facial scanners, and there are other brands that are not strictly for uh, dental use or facial scanning. There are toy scanners that might help you improve, and they are gonna help you start in your learning curve. If you get one of these cheap devices, maybe it's gonna be interesting for you, because you're going to be able to start your learning curve in an early time, so that then when you get a facial scanner, a true facial scanner, you're going to be faster with all this. And another way of making facial scanning is with your cell phone. With your cell phone, you're going to be able to do facial scanning in two ways. You will be able to use apps that you can download from your Google Store or Apple Store if you use iPhone. For example, unfortunately now Belus it's not more available. There is another one that it's called Beauty 3D that it's I think from Korea, that makes mostly the same that Belus used to do. But obviously they have some problems that we are going to see in some next slides. Or you can use your back camera of your cell phone and make photogrammetry. With your cell phone, you're able to do face scan in these two ways. And And the last way of making facial scanning, that obviously it's more expensive and not all the people has, it's with your CBCT. With your CBCT, for example, Planmeca and Carestream have released the last year a CBCT that takes a facial scanning while making the CBCT to the patient. So you can get matched the face of the patient at the same time that you're getting the DICOM file in case that you need that for some surgery purpose. But what do I have to pay attention when looking for a face scanner? Because as I told, we don't want to fall into that chasm. It is not going to be desirable for us to fall into that chasm. Not only face scanners, all the scanners have a device intrinsic accuracy. You will see all the spec data of different scanners, and they all have different specs. Sorry for being so redundant. The operator is extremely important because, as maybe you're used, while scanning with your intraoral scanner, you might or you should follow a workflow. It's not just getting the intraoral scanner inside the mouth of the patient and start zigzagging in every place and randomly in the mouth because you're going to make mad that intraoral scanner. Well, with the facial scanner, it's exactly the same. I don't have to start jumping like a monkey around the patient trying to get something. I have to follow a protocol to get a fast and accurate scan of that patient. The third point that sets skin type. There are patients that have a glossy, shiny skin, and those are difficult patients to scan with your facial scanner. You have to take in care the environmental conditions like lights. And when we come to this topic of lights, we have to check if we have LED lights, if we have halogen lights, or what kind of lights we have around us, because these scanners work in a way that might get uh, not confused, but they might give us some errors if we have the inappropriate kind of lights or if they are extremely shiny. Another problem with the light is when we are working, for example, near a window. If we get too much light from the outside, the sunlight, that it's bright, we are also going to get spots, white spots in our scanning, and the mesh it's not going to be the best one. And last but not less important, it's the congruence. The congruence of every scanner, it's extremely important, and we are going to see why I'm saying that. Face scanners, intraoral scanners, and table scanners generally work emitting a light source. As you can see in that picture, they emit that curtain, and that curtain has some specific specs that are read by the software of our scanners. For example, between each curtain, maybe you might have a 1 millimeter space. And while that curtain is hitting the surface of our object, it's going to deform. And our software is going to see that deformation and it's going to start processing our data. And while it's interpreting that data, it's going to build a polygonal mesh. But that polygonal mesh is built, as it says here in this slide, from a cloud. It starts building first a dot cloud, and then those points are unified, building our polygonal mesh. That is what we will see as final users, and that's the rendering of our object. And it's extremely important what I'm telling you, because with the different protocols that I'm going to show you, it's going to be about photogrammetry and facial scanning with a facial scanner. you are all going to get that polygonal mesh. But that polygonal mesh, it's going to be extremely different in the different cases due to the devices that we are going to use. And when we're working in our CAD software, we will pay that cost. If we have a low poly resolution, it's going to be a mess for us to work with that. For example, here I've done some photogrammetry with my cell phone. These pictures have been taken with a Xiaomi Redmi Note 10 Pro. It's not a great phone, it's an old phone. The camera, it isn't as good as it says the specs. And as you can see in the right side picture, where I have shown the polygons of that object or face of that patient, if you see at the neck, the polygons aren't even as they are in the face. That's due to problems in my protocol while taking pictures. And that's also a problem because the lights that were surrounding me weren't even. I had just some lights in the roof of where I was taking my pictures. And this is going to be an issue because if I want to cut that neck, I'm not going to get a perfect cut. I'm going to get an uneven cut of that neck, and my mesh, it's on my rendering, it's not going to be very nice. Then we have this option, face apps. We can take face, as I told you, Belus is not more in the market, but we can use, or we used to use Belus with our front cameras. And which was the problem? We had a nice mesh. It was an even mesh because the way that this app works is different. It's taking in consideration other things. But if you see, there are some problems that are mostly common to every 3D scanning protocol for facial scanning, that is the depth of field. And for example, here I have nice texture, but if you check, the eyebrows of that patient are like smashed into the face of the patient. Her eyes also look flat. We don't have a very, very nice mesh with these kind of apps, but they work. And how does this work? If you have a phone that has facial recognition, we will have an infrared camera and an emitting flood that is going to bring all these invisible dots to our face. And these dots are going to work more or less in the same way that I have shown you that a structured light in a facial scanner, intraoral scanner, or table scanner works. It makes more or less the same function. But the question again, why should I have to choose a facial scanner if I can get similar results with these devices and these protocols that I have shown to you now? With a facial scanner, I'm going to get more accuracy. And when we speak about accuracy, we're speaking about trueness and precision. Accuracy is under this umbrella of trueness and precision. Then we have the resolution of the acquisition that is going to be very important. Speed, obviously, nowadays we do not have time and we don't want to spend with our patients 2-3 minutes trying to get a good mesh of their face. Color. Nowadays, most or every scanner takes nice colors, or what we can do, or what I generally do when I don't get a nice texture or colors of my patient, you might have noted that when we export an OBJ file from our scanners, we get a JPG file generally with that OBJ file. You can get into Photoshop or whatever you use to make your photos, to post-process your pictures, you can change the contrast and brightness, and you can do whatever you want, and then you can export that with the same name that had originally the file. And when you get that into a software, a CAD software, like it can be ExoCAD, Blender, Mesh Mixer, you will get a nice picture in 3D. Because remember that the OBJ file, it's not more than an STL file that gets smashed that JPG file over it. It's different from the PLY files. They work different in regarding to the color. And then, well, what you have to take in care, obviously, it's if they are open or closed systems. Yes, nowadays, most of this kind of devices are open systems, so we can surf around different softwares. When I was speaking about accuracy, I told you that accuracy it's under the umbrella of trueness and precision, and this is extremely important not just for facial scanning, also for intraoral scanners. And we want to have obviously a high trueness and high precision. If we get both of these, we are going to get accuracy. If we lower some of this trueness or precision, then we are not going to get good accuracy, and that's what happens with cheap scanners. For example, I can get for example, I'm not going to say brands, I can get a toy scanner from a brand, and I will be able to scan some things, but every time I scan, I'm going to get a different result. It's not going to get the same dimension, my object. And that's the problem of these cheap things, or also it's the problem of my photogrammetry. I have to put some dots or markers in the face of my scanner, and when I measure those markers, maybe I'm not going to be measuring the same every time. Or if, for example, I take some of you to my practice and we scan with my phone, we're making photogrammetry, the same patient, and then we get into the software, we are going to measure different measurements to that patient because we are different, we are all different. And that's why when we buy this kind of devices, like face scanners, we want to get the best because we don't want to think in this. So here it's intrinsic accuracy that I was telling you, and it's extremely important. For example, with face scanners, I'm going to be able to have, if I get a good face scanner, I repeat, I'm going to have even results. For example, here I have a nice resolution. As you can see, the poly resolution, the polygonal mesh that I have, it's nice, it's even. And why is this? Because the facial scanner that I'm using, it has a internal light that it's going to crash into the face of my patient, and it's going to recreate the ideal environment. So that structured light is going to make the job that I don't want to think of in the post-processing. And why is this so important? Because when we scan, we are going not just to make one scan, we are going to make several scans. For example, we are going to have one scan with our patient with his mouth closed, then with our patient smiling, and then with the lips retracted. And if we don't an accurate scanner, the problem that we're going to have is that when we try to match all those meshes, there's not going to be congruency. For example, if I do this with my photogrammetry, I can do, and I'm going to get a nice result. But when trying to match all those 3D files, I'm going to get some hard work to do. But what we don't have to take out of our view, it's this, the depth of field. This is a very big problem with most of the scanners. Have you seen who has used Velus, for example, that we used to have these problems with our teeth? They are very funny in the way that they see, because here the depth of field hasn't been nice. The depth of field of most of the facial scanners that are now in the market, that are in a mid-range of price, get these results, similar results to what you're looking at this picture. And when this is gonna be a problem, this is gonna be a very big problem when we try to match our intraoral scans to that facial scan. If we don't get a nice depth of field, then our intraoral scans won't get perfectly matched into what we have scanned with our facial scanner. And that's going to come into a problem, because maybe we are going to be trying to see the contour of our teeth in relation to the soft tissues, and we are going to try looking many things. And if we don't get this, the work that you are going to have to do, it's very, very dense. Many researchers have done or have developed different devices to mitigate these problems. You can put a positioner inside the mouth of a patient, then you can scan that with your intraoral scanner, then scan part of the face with that device put inside the mouth of the patient, so that then you can match those things, and you can then finish matching the facial scanner to that device. It's very messy, and not everyone has uh, time to do that. So that's why we want to get good stuff that has this that I'm telling as an intrinsic ability. And why should we use a facial scanner in our daily practice? As I told you when I started, maybe there are many problems while taking our works from our practice to the local lab. And this is a very common situation to every one of us. I think that we have built at least once in our life a full denture. And this is a headache many times, because uh, we have to check where the midline is, the canine line where it is, the upper line of the teeth, lower line. We have to check many things. We have to check the, for example, Frankfurt plane, Camper plane. We have to check many things with this. And facial scanning gives us the ability to mitigate or correct many things that might have been done in an incorrect way in our practice. But what facial scanning won't do or won't solve is if we have done a bad intermaxillary relation. If we don't have our mandible positioned in the correct place, believe me that anything of this, it's gonna work. At least we have to, or we need to have a good interrelation of our jaws, so that when we make our mounting of the virtual patient in our CAD software, we can know that our antagonist teeth are going to bite in the correct place. And if we are sure of that, then we can correct other problems. For example, here I assume that the practitioner has sent me a nice bite in that bite block, or a nice interrelation. And inside or on the dental practice, they have taken some parameters in that wax rim, so that I can then make my teeth set up in the correct position. But, for example, in this case, the practitioner did an error. The midline of that wax rim, it's not coincident with the midline of the face of that patient. So these kind of things are the things that I can correct while working with facial scanning. And many of you might be thinking, all right, but I can do the same with a traditional DSD protocol. I just can take a picture from the front of the patient, a lateral picture, and I can do the same. Yes, you might be able to do the same, but working in 3D, it's gonna help you and give you, obviously, other point of views. For example, in this example, and this is the one that I'm gonna finish with, I'm making a teeth setup. In this case, it was a very, very difficult patient. This lady had an accident when she was 5 years old, and the left part of her face stopped growing. So she has a big difference in the left side and right side. So to make this look in the most nice way has been a headache, and thanks to facial scanning and all these protocols of 3D, I've been able to make it easier, and it has given me the ability and the possibility of rectifying problems without having the patient sitting with me in my dental practice. I think that that's a very, very valuable thing when we come into these kind of technologies, because it's going to be a big time saver for you and patients. You're going to have the ability to rectify, make things, change things, then you can 3D print, try that. And if you have a good protocol and you're clear with what you are doing, believe me that it's going to be a game changer in your daily practice. So to conclude, I have put those three things. It has been a very short webinar, but I think that these proposed devices and techniques accelerate very, in a very fast way your workflow in your daily practice. You have to be and take care that not all the devices have the same capabilities. Please taking care of that. Try to search and see what fits better to your demands. And obviously, as I have put there, take care with the protocols, because many times many people say, no, this doesn't work, this it's garbage, I won't take this, but it's because they haven't done a deep research, they don't know the protocols. And those are, from the graph that I showed you, the laggards, the last ones, the ones that say, I prefer my analog protocol, don't take me with this. And unfortunately, digital dentistry has come to stay, and for those laggards, it's going to be a problem, because nowadays we are merging from the analog to digital, and this doesn't mean that analog doesn't work. This means that we have to apply all our knowledge from the analog world to the digital world. So thank you very much for hearing me. I'm going to stop sharing my screen and